Welcome to this educational video on the complications of the third stage of labor, focusing on postpartum hemorrhage. Today, we aim to equip healthcare professionals with a comprehensive understanding of this critical condition, its types, causes, diagnosis, and management strategies. Postpartum hemorrhage is defined as excessive blood loss from the genital tract following the delivery of the fetus, typically exceeding 500 milliliters. It is a serious condition that can significantly impact the patient's health. There are two main types: primary postpartum hemorrhage, which occurs during the third stage or within 24 hours after childbirth, and secondary postpartum hemorrhage, which arises after the first 24 hours and can persist up to 6 weeks. Primary postpartum hemorrhage is predominantly caused by uterine atony, responsible for over 90% of cases. Other contributing factors include retained placenta and traumatic hemorrhage from ruptures or lacerations. Diagnosing postpartum hemorrhage involves a thorough examination, assessing the patient's general condition, abdominal and vaginal examinations to evaluate bleeding. Prevention and management are critical. During pregnancy, it's essential to detect and correct anemia and ensure hospital delivery for high-risk patients. During labor, proper use of analgesia and avoiding prolonged labor are key strategies. Postpartum care involves routine examination and careful observation. Treatment focuses on restoring blood volume through urgent cross-match blood transfusions and other anti-shock measures. Arresting bleeding may require a series of interventions, including uterine massage, administration of esibolics like oxytocin or ergometrine, and potentially surgical procedures such as uterine artery ligation or hysterectomy. Complications from postpartum hemorrhage can be severe, including maternal death in 10% of cases, acute renal failure, embolism, and other serious conditions. In secondary postpartum hemorrhage, causes may include retained parts, infections, or other gynecological issues. Treatment varies depending on the underlying cause, but often involves antibiotics or surgical intervention. In conclusion, understanding postpartum hemorrhage is vital for healthcare professionals to ensure timely and effective management, ultimately improving patient outcomes. We encourage all providers to remain vigilant during the third stage of labor to prevent these complications. Thank you for joining us in this important discussion on postpartum hemorrhage.